Welcome back to Health and Life. Rehabilitation can be crucial to returning to our best health. We're joined by Daniel Ballin, Riverside's Administrator for Therapy and Wellness. Thanks for being here.
And thanks for having me, Catherine.
Now, we've talked a lot about the broad spectrum of health care that Riverside offers. Where does physical therapy fit in that?
Well, the great thing about physical therapy and rehabilitation in general is that it fits across the entire spectrum of healthcare, the entire continuum, as we like to say. And what we do as therapists is we help with the seamless transition from one level of care to the next. So as people get stronger and they transition to a lesser level of care, therapists are there along the way to guide them. And we do that by helping patients maintain and achieve the highest level of function possible so that they can overcome their illness or injury, or they can just battle the normal effects of getting older.
So this isn't always something that happens just after a severe illness or injury.
No, and we're definitely involved with that, but we would like people to think of Riverside and the therapy group as their lifetime partner in their health and wellness journey. And by that, we're hoping to develop a partnership between the people providing care, the therapists, and the people receiving care, the patients. And this lifelong partnership will develop a trusting relationship that we like to call the patient-centered care. And with patient-centered care, we focus on the patient's needs and ask them to set individual goals and make sure that what their needs and goals are met through the rehabilitation process.
All of us with older parents or loved ones know the stress caused when they have an illness or injury, not just on them, but for the whole family, really. Within Riverside's concept of lifelong health, what role does rehab play for older adults?
Well, the main goal with rehab in the older adult population is we want to maintain independence for as long as possible, which really helps people improve their quality of life. And with the boomer population, sometimes they struggle with lack of strength or lack of flexibility, and we're going to work with them and help them improve that. They may have issues around endurance, so we're going to help them improve their endurance so they can chase their grandkids around the yard and still maintain that quality of life. Again, getting back to that. You know, they may be struggling to keep their golf swing up, and we'll help them with their strength and flexibility around their golf swing. We'll work on improving their shoulder strength so they can continue to play tennis. Or again, you know, we could be helping them after hip replacement or knee replacement surgery so they can stay active. And in the end, you know, we're going to be their partner in lifelong health and wellness so they can always turn to Riverside if they need help in that area.
So independence, wellness, lifelong health. Very nice. Thank you very much, Daniel Ballin. To learn more about rehabilitation services, go to riversideonline.com/rehab or call 757-875-7880. Now, when we come back, we'll talk with Riverside's Chief Nursing Officer about how Riverside ties together the concept of lifelong health and the Riverside Care difference. Stay with us.